I feel like she's family. My name is Leslie Centeno, and July 25th of 2022, I was diagnosed with breast cancer with ductal sarcoma in situ. I received the news through Dr. Peck that has sent me for a mammogram because I was having some breast discharge from my right breast. I remember going to my car and crying and thinking, breast cancer, me? Maybe she didn't know what she was talking about. And I was in denial. I was like, she don't know. Let's do the biopsy and we'll go from there and see what it says.
You know, most breast cancer patients are very overwhelmed and kind of shell-shocked initially.
Yes, definitely.
I think sometimes it hasn't even totally sunk in at first, and then it takes a while to sort of process everything.
Well, I got the results back and I said, Dr. Peck, whatever it is, just be straight and honest with me. I can handle about anything. And she said, okay, you have breast cancer. And I was in shock. After I got off the phone with Dr. Peck, my first thing was I was crying. Then I was like, I can't cry. I had to put on a brave face for not only for my dad, but for my boys. And I remember Dr. Peck telling me, I'm going to have the best team here. She goes, and I'm going to have them contact you and start setting up an appointment.
In general, with breast cancer, it is a team approach. Typically, there is a medical oncologist, a surgical oncologist, and then usually a radiation oncologist as well, and also the primary care doctor. So we're all doing different things, and then we all have to communicate to kind of create that whole care package.
I think I met Dr. Wegge first.
Well, I am Dr. Wegge. I'm a general and plastic surgeon, and I have been treating breast cancer patients for a long time, probably like 20 years. Leslie is my patient, and I am basically her surgeon as part of her breast cancer journey.
And I first met her, she introduced herself, Tara introduced herself. She already had my mammogram. She had went over everything. She was always accessible to me. And then I met Dr. Connect 2 days after I met Dr. Wegge. And Dr. Connect, I was nervous, but I was wanting to know what kind of breast cancer I had. What stage was I at? What's the plan for treatment? And when he came in, he had my mammogram on the computer, was looking at it. And he says, okay, well, you have ductal sarcoma in site 2. He says it's contained. He goes, you're at a stage 0. And for me, at a stage 0, it was like a huge relief. He goes, you don't need chemotherapy, you don't need radiation. It looks like they caught it early.
The earlier we get at it, the smaller it is, the easier it is to take care of, and you also want to remove it before it spreads anywhere else. So the earlier you find it, the better. It makes treatment easier and usually downgrades the amount of treatment that patient is going to have. You know, if it's very early, maybe all they need is surgery, or maybe just a hormone blocking pill and nothing else.
Maybe a week or 2 later, I had an MRI. And then a week later, I had an appointment with Dr. Wegge to come in that she had my results. And so when she went to go see her, I was like heart racing, thinking, okay, what's next? What else did she find? And she comes in and she says, after I got your results from your MRI, she says, I'm going to have to do a full mastectomy. And I said, what does that mean? And she said, well, the lumpectomy we talked about was just cutting your breast, removing the 2 tumors, and be done. She goes, but after your MRI, she says, I have to take your whole breast, all your breast tissue.
And that's the hard thing too. You know, breast reconstruction is not always an easy journey. It can have complications, and patients have to be ready to deal with that. And sometimes it doesn't work and you have to try again, but we get you there.
What's helped me is a lot of family support. My small circle, which would be my boys, my dad, and my brothers and sisters, have helped me a lot. I've relied a lot on my church family for prayer. I've also got a lot of support from Dr. Wegge and Tara. I felt like they understood me more. They knew the process. When I felt like, why is this happening to me? Why is my body doing this? Dr. Wegge would explain to me that this just happens.
I think it's just being there, and like Leslie already said, it's being available. You don't know what the patient is going through at any moment, and you need to have that communication and be able to kind of quell their fears.
Normal to be scared, just Trust your care team. Make sure they're available when you need help. Don't be afraid to ask for help. Don't be afraid to ask questions. Write your questions down. And remember, this too shall pass. It's not forever. It's just for right now. There's light at the end of the tunnel. When it seems like there's not, there is light at the end of the tunnel. Just get you a good support system, people that you can lean on, people that you depend on, people that you are comfortable with, and this too shall pass.
A lot of these women are used to being the caregiver in the family and being independent and not having other people care for them. So it's hard for them to ask. So ask them, what do you need? And then they'll tell you. And then that's how you can help. And just being there, that's the biggest thing.
Wow, on my health, for any little thing now, I'm ready to go to the doctor. If I find something, see something, okay, this is not right, I'm ready to go to the doctor. Before I was hands off. I didn't like the doctors. I don't like to be touched. I didn't want nothing to do with it. You really don't know what they do until you've been in that position and you're like, okay, they do a lot. And I got a lot of respect for them, and especially for Dr. Waggy. I love Dr. Waggy and appreciate her staff. Basically, everybody at CLS, they've helped me so much. If it wasn't for Dr. Peck on top of it, introducing me to Dr. Waggy and Dr. Connect, I don't know where I'd be today, to be honest with you.
I think the most important thing is making sure that you're getting your mammogram every year. And some people think, oh, mine was fine, next year I can skip it. No. Within a year, sometimes we can find a huge difference compared to a previous mammogram. Doing it yearly is extremely important to not miss anything. And then a lot of people don't realize what they have available too. They're scared, but we have so much technology now, so many options. You know, you can go through breast cancer and still feel good about yourself. And there are a lot of minimally invasive options out there. It's just, everybody needs to know more about what's available. So
get your mammogram. Stay on your yearlies of everything. Get your check. Nothing is too small. There's no dumb questions. Whatever you see something's not right, get it checked. The sooner, the better. And just keep on top of your health. If you're not take care of yourself, nobody's going to take care of your health. You got to put it as a priority. I love Dr. Waggy, and I thank you for everything, you and Tara, for everything, and the staff, of course. I feel like she's family.